Thank you very much, Mr. Casey. Turning to the Canadian Alliance on Mental Illness and Mental Health, Ms. Cohen, member of the Management Committee, and Mr. Phelps, Saskatchewan-born at that. Welcome.
Thank you, Mr. Chairman, and to all members of the committee. My name is Fred Phelps, and I'm the Executive Director of the Canadian Association of Social Workers. I'm here with you today with Dr. Karen Cohen, the CEO of the Canadian Psychological Association, and we are proud representing the Canadian Alliance of Mental Illness, Mental Health today. Established in 1998, CAMIMH is what we call it, is a unique coalition of 17 organizations that represent both those who provide health and social services, as well as organizations that represent people with lived experience with mental illness, their families, and their caregivers. CAMIMH has a long history of using its collective power for mental health advocacy, calling for and having the creation of, and then a decade later, the extension of the mandate of the Mental Health Commission of Canada. CAMIMH also advocated very strongly ahead of last year's federal provincial discussions for a new pan-Canadian health accord, with dedicated funding to support increased access to mental health services so that many Canadians that need them are able to receive them. The 2016 and 17 Health Accord and its bilateral agreements that include $5 billion in dedicated mental health funding over the next 10 years represents a historic achievement and a strong start in seeing what CAMIMH has advocated for, the Government of Canada contributing 25% of provincial expenditures for mental health. CAMIMH also supports the common statement of principles on shared health priorities that will guide the bilateral agreements and investments in mental health over the next 10 years. We have all come to understand that you cannot manage what you cannot measure, and there are data gaps in our understanding of what is being delivered in mental health services, its effectiveness, and who is being served both in the public and private settings. That is why CAMIMH supports a standardized set of pan-Canadian indicators that would serve to improve the accountability and transparency of mental health care and delivery, identify areas of high performance, accelerate the adoption of leading practices, and highlight where improvements are required. In support of nationwide indicators, CAMIMH advocates that the federal government establish a 5-year, $100 million mental health innovation fund. It is our view that this targeted and time-limited fund would jumpstart the spread of innovation and build a foundation for systemic and sustainable change to meet the mental health needs of all Canadians in Canada.
Canada's health systems fall short in making evidence-based psychotherapies available to Canadians who need it. Psychotherapies delivered largely outside of publicly funded institutions by non-physician providers are not covered by our public health insurance plans. While many Canadians have access to private health insurance through employment, coverage for psychotherapies is often too low to afford a sufficient dose of treatment. Canada needs more systemic change to its mental health delivery systems, change which requires intergovernmental collaboration and commitment. Better access to better mental health care can be achieved by resourcing evidence-based, interdisciplinary primary care that supports mental wellness, delivers early intervention, and treats chronic conditions. Increasing mental health capacity in tertiary care, investing in community-based social and health services, and implementing new technologies to extend the reach of mental health care. The United Kingdom and Australia have made systemic change with promising results. Options for Canada to implement such change to the delivery of mental health care have been proposed and costed out, either by enhancing mental health resource on primary care teams, augmenting fee-for-service models through private extended health care insurance, or adapting UK models for Canada. Services and supports for mental health and illness are not limited to assessment and treatment. Improving the social determinants of health can transform the lives of those living with or at risk for mental illness. Mental illness impacts everyone, and income is one of the most important social determinants of health. A universal basic income to support all Canadians should be explored. This program could build on existing tax mechanisms such as the Guaranteed Income Supplement for seniors, the Canada Child Tax Benefit for families with young children, and the Goods and Services Tax credit. Finally, the federal government should introduce a Mental Health Parity Act that affirms that mental health is valued equally to physical health. A Mental Health Parity Act will help ensure that communities and workplaces, through their policies, programs, and benefits, attend equally to mental and physical health. Canada cannot afford to continue its current path of inaccessible mental health services and supports. The costs of mental illness to the economy and the workplace are massive. 500,000 Canadians in any given week are unable to work due to mental illness. The private sector spends between 180 and 300 billion on short-term disability for mental illness and 135 billion for long-term disability. In 2011, the economic cost of mental health problems was measured at 51 billion. CAMI urges all levels of government to heed the recommendations of the mental health community and make mental health change happen. Our recommendations are explained in greater detail in our formal submission. We thank you for your time today and look forward to any questions.
Thank you. And